Hi everyone, my name is Sophia Winston, and this is my Girl Scout Gold Award project. It is titled Breaking the Silence: Understanding Eating Disorders. So, a little bit about who I am. I'm a junior going into my senior year at Palisades High School. I'm a Girl Scout ambassador in Troop 17285, and I've been a Girl Scout for over 12 years. I earned my Bronze Award in 5th grade and my Silver Award in 7th and 8th grade. So, what is my project? My project is to educate preteen girls and young teen girls and their families about the causes, effects, misconceptions, and realities of eating disorders. My project normally consisted of two presentations, one for the troop and one for the troop parents, but this is a video recording, so it's for everyone. Why is my project important? I have a couple of reasons that I found important to myself. The first one was eating disorders are either not taught in schools or they're not taught correctly in schools. The first time I learned about an eating disorder was in 7th grade, and all I was shown was a video of children who suffered from anorexia and were completely malnourished. And this was not a good representation of eating disorders and how they affect someone's mental health, not just physical health. Another reason why they are important to learn about is that eating disorders have the second highest mortality rate of any psychiatric disease. And then it's also most common for a woman to develop an eating disorder in between the ages of 12 and 25. So here are some root causes I identified within my own community. The first is that healthful eating is commonly taught in elementary schools. However, the distinction between healthful eating and under eating is rarely taught. When I was in elementary school, I was taught to check the sugar amount and calorie amount on any nutrition label and to limit calories and sugar. But I was never taught the importance of making sure I was nourishing my body and eating enough to sustain my brain and my body functions. Students are also rarely taught about eating disorders in any capacity until at least 7th grade, if ever, and that is well beyond the time when someone can develop an eating disorder. You can develop an eating disorder at any age. There's also a lack of body acceptance in society and harmful messaging about food caused by social media and just life in general. Now, I'm going to talk about some common misconceptions in eating disorders. The first is dieting versus disordered eating versus eating disorders. Dieting within itself is not a bad thing. If someone wants to become more healthy in their body and their lifestyle and be able to do more things in their life, dieting may help with that. But when dieting becomes a compulsion and something that they have to do and becomes an unhealthy habit, that's when it becomes an issue. Disordered eating may be some common times when someone limits their food intake or does something to lose weight or does something to hurt themselves when it comes to food or weight. But it does not happen all the times and it's not continuous. An eating disorder is a continuous habit around food where they're hurting their body and their brain. Another misconception is that there are weight qualifications for eating disorders. There are zero weight qualifications for eating disorders. A person can have an eating disorder where they limit their food intake but be at a healthy weight or even be overweight. And a person can have an eating disorder where they eat in large amounts and be underweight. Another misconception is that eating disorders are an effective or long-lasting way to lose weight. This is not true at all. Normally, any weight loss through an eating disorder will be gained back within recovery, which is a positive thing. It's the weight your body needs to live and function correctly and properly and to the fullest. Eating disorders also will cause your body to store more fat in case you ever try to starve yourself again and your body's preparing for that. Another misconception is that health is determined by weight. That is not true at all. Everybody carries weight differently in their body, and they have to be the different weight to be healthy. You do not have to be underweight to be healthy at all. Again, another misconception is that eating disorders are caused only by a desire to lose weight. They can be caused by a number of different reasons. Some have to do with control or stress or just impact from their surroundings. And the last misconception I'm going to talk about is that eating disorders are only about food. A lot of the time, they're about wanting something to control in their life or to deal with stress. So here are some statistics I found that thought were very notable about eating disorders. The first is that more than 70% of people struggling with eating disorders will never receive the necessary treatment. This means that they will never talk to the professionals that will help them truly recover from the illness. Then 22% of children and adolescents struggle with disordered eating. They may not develop an actual eating disorders, but they may have at one point in their life done something that was considered disordered. Every 52 minutes, one person dies as a direct consequence of an eating disorder. This goes to the fact that it's the second deadliest psychiatric disease. Only 6% of those diagnosed with an eating disorder are medically underweight. Like I said before, there are zero weight qualifications for an eating disorder, and many times when someone is dealing with an eating disorder, they will never be medically underweight. And then by age 14, 60 to 70% of girls are actively trying to lose weight, and this can be happening even if they do not need to lose weight or they are already underweight. So here are some common types of eating disorders. There's anorexia nervosa, bulimia nervosa, binge eating disorder, avoidant restrictive food intake disorder, which is known as ARFID, and other specified feeding and eating disorders, which is known as OSFED. I will be talking about the first three in my presentation, but if you're interested in the other two, I strongly recommend looking at the resources I put in at the end and educating yourself on that. So the first one we will be talking about is anorexia nervosa. The textbook definition is a restriction of food intake to the point where it negatively affects a person's health. Some warning signs is distorted body image, which is where a person may view their body differently as they actually are. So they could still be very healthy or very thin, but they view themselves as being very overweight. Another is an intense fear of gaining weight and then fixation on weight and food. This could be counting calories, weighing out food, weighing yourself, anything that's like a hyperfixation on weight and food. Then there's denial of hunger, weight loss, low heart rate, and constipation. So, anorexia can lead to long-term and lifelong effects. Some of them are anemia, which can lead to always feeling cold and thinning of hair on your head. This is when there's low amounts of iron in your blood. Gastrointestinal issues, when you are not putting enough nutrients into your body will shut down non-essential functions, one of them being your digestion system. Dizziness or fainting, organ failure, such as your brain and your heart, menstrual irregularity, which again is shutting down non-essential systems, which would mean you would lose your menstrual cycle, infertility, osteoporosis, memory loss and disorientation, and then growth of excess body hair. When you have being feeling cold because your body is not putting enough nutrients towards your central nervous system to keep your body's warmth regulated, your body will grow excess hair to keep you warmer. The second type of eating disorder that we'll be talking about is bulimia nervosa. The textbook definition of this eating disorder is recurring episodes of binging and purging, which is the act of using extreme methods to lose calories, which is like taking laxatives, forcing oneself to throw up, and extreme exercise. This cycle typically occurs at least once a week for months at a time and commonly co-occurs with self-harm and substance abuse. But like I said, eating disorders look different for everyone. Some warning signs is binging and purging itself, extreme weight fluctuation, which means that one week someone may weigh a certain amount, and the next week they may have gained or lost 5 pounds. Secretive eating, misuse of laxatives. This means using laxatives for the purpose of losing calories. Obviously, sometimes people have to use laxatives for medical reasons, but this is purposefully to lose calories in your system. Going to the bathroom right after eating, this would be to purge by throwing up. Feeling out of control when eating, discoloration of teeth, and heartburn and acid reflux. The last two are caused by throwing up, forms of purging because of the acid coming up from your stomach, damaging your stomach and your teeth. Bulimia also has long-term and lifelong effects. Some of them are dizziness and fainting, tooth decay and gum disease. This comes through throwing up, purging, dehydration, development of ulcers, which is typically in your stomach, gastrointestinal issues such as bloating, diarrhea, and constipation, kidney and liver damage, and cardiac arrest. The third type of eating disorder that we'll be talking about is binge eating disorder. The textbook definition of this eating disorder is recurring episodes of out of control overeating to the point where the person experiences extreme fullness. These episodes generally take place in a rapid manner in a short period of time, and the person often does not taste or remember everything that they eat. And then binge eating disorder is the most common eating disorder amongst adults. This is because adults grow up in a period of diet culture and thinness, and then when they become older and they allow themselves to finally eat the foods that they didn't when they were younger, they overeat and lead to a binge eating disorder. Some warning signs are inability to detect when hungry and full, restriction of food intake, feeling of a lack of control around food, secretive eating, restricting food in public then eating large amounts when alone, and feelings of shame and embarrassment around food and body image. Again, binge eating disorder can lead to long-term and lifelong effects. Some of them are type 2 diabetes, osteoarthritis, increased blood pressure and cholesterol, chronic kidney problems, sleep apnea, and heart disease. And then a note for all types of eating disorders that they can result in nutrition deficiencies, which may impact metabolism, growth and development, cognitive functioning, and emotional regulation, which means that it can affect a person's um, development in school, in their job, and their social situations, and how they interact with others. So here are some common causes of eating disorders I found within my own community. But like I said, eating disorders are so specific to the person, and if these do not apply to you, that does not mean that you aren't struggling. The first I found were sudden changes. So this could be someone moving to a new school or a new city, and they have found that they have a lack of control. This leads into the second, where there's a stressor in someone's life and they want something to be able to control, and what they do is they turn to food in their food intake. Another, which is a common one that people think, is comments being made about body or food intake. This may lead to someone having a desire to lose weight. Another common cause of eating disorders is starting to diet or exercise. In and of itself, healthy eating and exercise is great for your body, but when it turns into a compulsion, that's when it becomes a serious issue. Other mental health disorders can also lead to an eating disorder. If someone's suffering with depression and they can't get out of bed to eat and they lose a significant amount of weight and they are scared to eat, that can lead to different eating disorders. And then also genetics. How you're raised says a lot about your food intake and how you view food, if you view food. If you're raised in a household that promotes diet culture and thinness as being the healthiest version of yourself and limiting calories, that can often lead to someone developing an eating disorder later in life. So here are some mental health links because eating disorders commonly co-occur with other types of mental health disorders. The first is that 70% of people with eating disorders also have other conditions, for example, anxiety and mood disorders. 55 to 97% of people diagnosed with an eating disorder are also diagnosed with at least one other psychiatric disorder. Between 16 to 70% of people with eating disorders are also diagnosed with ADHD, and 10 to 35% of people with eating disorders are diagnosed with OCD unrelated to the eating disorder. The most common psychiatric disorders that co-occur with eating disorders are mood disorders such as major depressive disorder and anxiety disorders such as OCD and social anxiety, and then post-traumatic stress disorder. Now I'm going to talk about cognitive functioning in relation to eating disorders. Eating disorders do not only affect the body physically, undernourishment can negatively affect sleep, memory, attention, and concentration. If the brain does not receive as much energy as it needs, it will shut off non-vital functions such as critical thinking abilities, which can affect how a person performs in school and in their job. And then starvation can also trigger negative mood swings that lead to irritability, anxiety, and depression. Now we're going to talk about the different forms of treatment. The first form is outpatient treatment, where a person will go to a private therapist and dietitian and have sessions done as needed. The second is intensive outpatient treatment, or IOP, where support is offered for around a half day and it will be outside of school and working hours, and it'll be a requirement about 9 group or individual therapy sessions a week. The third type of treatment is partial hospitalization treatment, or PHP, which is a full day of group and individual therapy sessions with meals with professional support, but patients do not stay overnight at the treatment facility. They'll often have about 2 or 3 meals with the professionals and about 2 or 3 snacks as well. Then there's residential treatment. This is where a patient goes to a home and lives with a bunch of other patients who are around the same age dealing with an eating disorder, and they receive around-the-clock therapy and support. There will be live-in therapists, dietitians, psychiatrists, and other workers, and they will have all meals and snacks at the facility, and they'll stay for about a couple months or as long as they need to recover. Then there's hospitalization. This is where a patient stays at a hospital with around-the-clock supervision by professional doctors, and this is often an option when the patient is facing life-threatening physical or mental health issues. So next I'm going to talk about recovery. Recovery is not linear and relapses can happen and they're very common. And it may seem like a setback, but it is only temporary. It's very common for those in eating disorder recovery to develop a different type of eating disorder later on. For example, if someone was dealing with anorexia and severe restriction, they may then develop binge eating disorder once they allow themselves to finally eat food again. Similarly, if someone is dealing with a binge eating disorder, they may develop anorexia when they're trying to recover and limit their food too much. It's important to surround yourself with people who support you and to distance yourself from people who promote you to stay in this harmful mental state. It's also important to not fight your body and allow yourself to eat the food that your body is telling you it needs. If you experience extreme hunger, that is completely normal, and it's important to provide your body with the correct amount of nourishment. Next, I have some information for parents. My first piece of advice is to consult a professional. If you notice that your child is purposefully undereating, talking about weight loss, trying to overexercise, and losing a significant amount of weight, I recommend getting in touch with an eating disorder specialist doctor. It's very important to get professional advice because you think you may know what's best for your child in this situation, but the doctors are the ones that are medically trained and will be able to provide the correct amount of support for your child. It's very important to provide a safe space for your child and be open to listening and learning. Your child is going through a very difficult time, and you need to be a place of support, not a place of lectures and disagreements. It's also important to acknowledge how your own actions can be helping or hurting the situation. A lot of the times, parents are unknowingly promoting diet culture and a stigma around food that can be hurting their child's view of food and body image. And my last thing is find support for yourself. This is a difficult time for all family members involved, and it's important to be able to get help for yourself so you can help your child. It's very common for parents of children who are suffering from a psychiatric disease to seek therapy themselves to be able to better regulate their own emotions and help their children. This is a video, so there's not going to be any questions right now. But if you do have any questions, please feel free to leave them in the comments below and I will get back to you in answering. Thank you all for watching my video. This is such an important topic to me, and I find that it's really prevalent in today's community with social media and diet culture. Again, thank you so much for watching. Make sure to go follow my project Instagram at Sophia Winston Gold Award Project. And yeah, I hope to see you all soon.